Welcome to the Baby Playbook podcast. Really exciting to chat to our guest today because this is all about the care that you should be prioritizing or that you should be seeking out post birth. So, this one is for the mamas who, whatever birth story you have and whatever birth journey you've had, it's really important that we all prioritize our own health as well as the health of the baby. I think when you first have a child, especially if it's your first, you have so many appointments and worries during this time for the baby. It's all about the baby. It's all about the milestones. It's about, when are their vaccinations? When should I be going for a checkup with the midwife? You tend to really forget about yourself and the fact that you've just been through a birth, which is, a major medical event in your life that needs, attention and care and needs, I guess, the proper time to heal yourself after that. And you're so consumed by what the baby needs during this time. I really want to encourage everybody to find some time to focus on their self, even if it's not, I guess, the self-care that we hear about all the time, because I know that can be quite a bit of pressure. Find some me time, have a coffee by yourself alone. I think that can, fall to the side for a bit. But what is really important to keep going is yourself and your medical care. So I want to share some resources and tools to help you. I want to introduce our guest today. Dr. Kavya is a GP obstetrician. She's based in Sydney and she has interest and experience in female health and children's health as well. So the perfect combo for this conversation. Dr. Kavya, you're also a mum to a baby and a toddler yourself. Outside of the clinic, you enjoy spending time with your family, listening to books on Audible. Love that, whenever possible. Self-care, finally have made it there. And you've been recently binging This Is Us, which that's been on my list for so long. I need to get my Disney Plus account going so I can watch it. So thanks for the recommendation. Now, a really fun fact is I met Dr. Kavya in a GP office. So I walked in. I don't actually remember what the appointment was about. It could have been about me. It could have been about one of my kids. But I just felt a really warm, inviting feeling from you. And it was a really pleasant GP experience. Not going to lie, I am one of those people that books an appointment with whoever's available. I don't tend to try and find a GP, but you really encouraged me to form a bit more of a connection and a history with a GP to be able to have that care and that comfort and that understanding in this long journey of post-birth and motherhood. So thank you so much for joining me.
Thank you so much for having me and that really nice introduction. And you really nailed it at articulating why that postpartum recovery is so important for mums, because I almost never have to tell a parent or a new mother that they're not looking after their child adequately or providing enough care for their child. So we almost never have to tell parents that, but we almost always have to remind parents that they need to prioritize themselves a little bit more. And as you said, they've just been through a major sort of transformation of their body through 9 months of pregnancy and recovering from surgery or birth, whatever type of birth they've had. And yeah, it's really hard to make time for yourself. So these reminders and sort of tips that we'll talk about today hopefully will be helpful for lots of people.
Amazing. Well, let's kick off first with, I think for many people, there's a lot of people involved in the birth process. So you might have a midwife, you might have an obstetrician, you might have a GP that you continue visiting during and up until the birth. There's quite a few people involved and everybody's context is different. So tell me, what's your role as a GP, particularly during the postnatal stage, and how does this fit in with all of the other care?
Yeah. So my role as a GP during the postnatal phase includes so many different things for both mum and baby. And midwives and obstetricians can certainly provide a very thorough postpartum review and support. But one thing GPs can offer that the others may not is the provision of vaccinations if needed, referrals to other doctors or services if required. And as you'll see, as you'll hear as we discuss this, there's actually quite a lot to cover, and often we need multiple appointments to get through everything. So a GP can be a great person to provide more continuity of care rather than that one-off appointment you might have with your obstetrician or midwife at that 6-week check. The other thing is if you're a regular patient to your GP, we're also really well versed with the remainder of your medical history. So if we made medication changes before you fell pregnant or at the start of your pregnancy, or if you're due for checks for your other health conditions, we're like a great person to review all of that really comprehensively as well.
Yeah, so important. And I think something that I look back on that I perhaps could have done in the lead up to birth was perhaps locking in these appointments before the baby came. So then they were in the diary, they were ready to go because, once the baby's there, it's really hard to start doing a bit of admin and thinking, oh, I should go see my GP, or I haven't called, I haven't gotten an appointment. So perhaps creating a bit of a plan in the lead up would be a great way to kind of get it locked in and sorted. So, what should mums be focusing on when it comes to their health following a birth?
Um, when it comes to their own health, I guess rest is a really important thing. Obviously, you've got a newborn to care for, and I completely appreciate the varying realities of access and resources, supports, finances, and other children if this is not your first baby. But if you have the opportunity to delegate, outsource whatever you possibly can, so you can just focus on feeding your baby and resting whenever you can. And when I say rest, I really mean like putting your feet up, resting that pelvic floor and the perineum, and trying to um, really allow everything to heal. Obviously, still want you to take gentle walks and mobilize as tolerated, but rest is actually really important, and not many of us get a chance to do that enough postpartum. And yeah, your body's been through so much, whatever type of birth you've had. So we need a lot more rest than we realize. And we want you to look after yourself physically, mentally, emotionally. So you know that looking after a baby is more than a full-time job. So often it comes at the expense of looking after yourself as best as possible. So yeah, just rest is my number one tip. And we can go through all the things that we would discuss in that first week 1 or week 6 appointment for mum as well when you're ready.
Of course. And what is one thing I want to ask that you found in your experience that mums tend to neglect the most during this time? It might be rest or it might be something else. But what's one thing that seems to be a common occurrence?
I don't know if I have one thing specifically, but because there's so many different aspects to our recovery, and we obviously have a newborn to look after. I think one thing will always fall to the side, or multiple things. So I don't necessarily have a common theme, but yeah, definitely out of the many, many things we need to be addressing, some of those will always fall to the side. So having a regular GP that can look after you through all of that is useful. So I can jump into the 6-week appointment now if you like, so we can go through that and see how it's easy for some of these things to just fall off to the side. So in that first appointment, whether you come 1 week postpartum or 6 weeks postpartum, we'll talk about the birth, and we've been hearing a lot more recently about birth trauma, which is really good. So we can provide some debriefing if that's needed. We'll be talking about your recovery. So, is your vaginal bleeding settling down? How much pain are you in? Do you have adequate pain relief? Are you able to move around comfortably? And we need to look at your wound healing. So, whether that's the perineum or the surgical wound, are your bowel and bladder functioning normally? Are you having any issues with incontinence or leaking? We'll obviously talk about your mental health and how you're coping. We do a questionnaire called the Edinburgh Postnatal Depression score. We'll talk about how you're bonding with baby, if there's any changes or issues with your relationship with your partner, because often that can get quite strained postpartum because there's so much going on. Social support, so who's at home to give you a hand? Are you feeling safe at home? Breastfeeding, if that's how you're feeding your baby, so how is supply going? Nipple damage, blocked ducts, mastitis. There's so many things that can affect breastfeeding issues. And even if you're formula feeding, is baby having any issues with the type of feeding that they're receiving? A lot of patients want to discuss returning to physical activity, and that includes sex as well. So physiotherapy, exercise physiologist, women's health or pelvic floor physio specifically can be really useful. Contraception, to answer your earlier question, this is probably one that gets missed quite commonly. So your fertility can go back to normal as early as 3 weeks postpartum, even if you're exclusively breastfeeding, even if you're not having even if you haven't returned to having periods. So if you're not planning another baby in the very near future, it's very important to prioritize that. A medication review. So I mentioned earlier, lots of people might need to stop or change certain medications at the start of their pregnancy or just before they plan a pregnancy. So we need to look at whether we need to go back to their previous medication. This is another common one, actually, iodine for breastfeeding mothers. So lots of people stop their prenatal supplement after their pregnancy ends, but actually breastfed babies rely on iodine from mum, so it's really important to continue that prenatal supplement or get a breastfeeding supplement. Iron supplements can be important for some patients if they've had a postpartum hemorrhage or just breastfeeding and not being able to eat as well as you normally would in the whole postpartum madness. Iron deficiency is quite common, so we might need to do a blood test and look at iron deficiency and if an iron supplement's required. We can talk about future pregnancy planning if that's a priority for some patients. We need to talk about what's happened in that pregnancy. Did they have hypertension or preeclampsia? Do we need to be monitoring your blood pressure? Did you have thyroid issues in pregnancy? And we need to follow that up and see if that's normalized. If you had gestational diabetes during pregnancy, we need to repeat that glucose tolerance test postpartum. Sometimes we pick up at the start of pregnancy that you might not be immune to rubella or hepatitis B or certain things that we can't give you during pregnancy, so those vaccines might be due. If you had a negative blood group, we want to make sure that anti-D injection was given postpartum if that was required. And then we need to do an examination, so checking your tummy, your scar, perineum, blood pressure, all of those things. So it's quite easy amongst this, mountain of a checklist for one or more of these things to get forgotten.
Yeah, of course. But I love that you've run through that because it also shows you how holistic this appointment can be. It's not just, I think people think, GP, they think, oh, if I'm feeling fine, I don't really need to go. But it's all these questions that need to be asked and addressed by the end of the appointment and further on to be able to really keep you on track as a mom. And I think the other thing to note here is that if you are performing at your best as mentally, emotionally, physically, making sure that all the levels are correct, then you will only become or be able to be a better mum to the baby. So it's really making sure that that foundation is right so that you are able to get through this newborn mess of a period at your most excelled ability, because you are looking after yourself, you're feeling good, your levels are great, and your health is there, which is so important. So one thing I want to ask is, it is a lot. It feels like a lot. How can you possibly find the time to put yourself first? So we talked a little bit before about perhaps locking in this appointment pre-baby. So it's in there, it's in the schedule. You don't need to be making any phone calls. What are some other tips that you have of making it a little bit easier to keep up?
Yeah. I guess everyone's a little bit different, but a few things that helped me were being organized ahead of the birth. So making appointments and things like that with your pelvic floor physio or a lactation consultant or whatever supports you want to utilize postpartum. I did things like preparing meals that I could pop in the freezer before baby arrived, or even asking friends and family to do one or two meals for you that you can put in the freezer, and organizing things like nappies and basics so you're not in a scramble once baby arrives. Utilize all the supports and resources that are available to you. So I delegated and outsourced whatever I could. Obviously, this is not doable for every person, but if you can, things like cleaning, meals, dog walking, groceries, just outsource whatever you can so you can just focus on feeding your baby and resting. Be firm with your boundaries with family and visitors. So if there's just a lot going on and you're finding it a bit overwhelming to have guests, you can 100% put yourself first. If having visitors for a while is a bit too much, just tell them. Or say, hey, I'd love for you to come visit, but I'm exhausted. Do you want to take the baby for a walk for half an hour so I can just put my feet up? So put them to work if they're coming over. And I think the most important thing is communication. So verbalize what you need, every basic need, so you can keep looking after yourself. Hey, can you please hold the baby for 20 minutes so I can have a shower and have some food? Verbalize to your partner, parent, support person, whoever is with you, that you need 30 minutes of kid-free time every day to do whatever you need to do, go for a walk or read or sleep or, whatever it is you want to do to look after yourself.
I love all of those tips, especially the outsourcing and whether it be to friends or services, groceries. I think that's a really important part of surviving those first 6 months, because you may, and as you said, not everybody has that help, but I guess, if you don't have, mum to come over and look after the baby, you might have that friend that offers to come and visit. And that could be an opportunity for you to sit up and pop the baby down and perhaps like give your back a rest, give your arms a rest. Babies can get very heavy, especially, when you're rocking them during that time, it can be quite straining. So I think, yeah, really important message there of rest is key during that time and asking for help. I want to ask you, can you share some of the services that I guess you recommend to mums in the past that a lot of mums just don't even know exist? I know I've relied on a few services. Now, we are, of course, in Australia. This might be different elsewhere, but I know a big service for me was, for example, the Australian breastfeeding hotline, which I called 400 times in the middle of the night. It's a 24-hour service. I couldn't believe it was free. So I was on that 24/7. I also relied on Panda for some postnatal blues that I was experiencing. I think there are quite a few resources, but it can be really hard to find them. Whilst you're Googling 400 questions, there's a lot coming through. So what are some of the key services that you've found that you highly recommend to mum?
Yeah, yeah. So lactation is one that you mentioned. So there's lots of lactation consultants available, and there's an online website where you can find a list of lactation consultants and search by your area. So I'll try find that link to pop in the show notes for you. There's continence services. So people often think that leaking when you cough or sneeze or having issues with urgency or accidents postpartum is normal, but actually we've got lots of services to help manage that. So you can start with your GP. You can see a women's health or pelvic floor physiotherapist. There's lots of specific or specialized continence clinics and services as well. If you have an obstetrician gynecologist, you can speak to them also. Mental health services, as you mentioned, so there's online, phone, in-person, public, private, inpatient services as well. So if you're having difficulty with baby blues or perinatal anxiety or depression or something else, definitely reach out early rather than later, and be proactive about that. Sleep services is another big one. So if you're having issues with settling baby or baby sleep, you can reach out to a sleep consultant or a sleep support clinic. There are lots and lots of them out there. And I've mentioned this a few times, but pelvic floor physiotherapy is the other one. So lots of people don't realize that strengthening your pelvic floor postpartum is really, really important, not just for continence, but lots of other reasons. So utilizing that, almost everyone should have at least one pelvic floor physio appointment sometime around the 6 to 8 week postpartum mark to have an assessment of how everything's going and some education on how to look after your pelvic floor long term.
Amazing. Thank you so much for sharing all of those. I think such a great conversation to have, really open and out there, making sure that we're prioritizing our health whilst we're looking after the baby, whilst we're trying to figure out how to prioritize their health as well. And hopefully making it a little bit easier for us to recover after this huge event in our life. Thank you so much, Dr. Kavya, for sharing. I am sure we will have you on the podcast again to talk about a completely different topic, especially the baby health side of things, because that's a whole different side that, of course, mums also need to wrap their head around. If you would like to keep up with Dr. Kavya, Two Aussie Doctors is her Instagram page. You and your husband have that medical background, and I love the information that you share there. It's really helpful. I know as a mum, I was relying a lot on finding some key accounts where I trusted, a bit of information, a few tips and tricks. So please do follow her there. And as we mentioned, a few of those resources, we will pop them in the show notes so everybody has access to be able to head on over, search and Google and get some care organised for this crazy time in their lives. Thank you so much, Dr. Kavya.
You're welcome. Thanks so much for having me.